Welcome to Pharmacology for Nursing, Unit 2, the nervous system. We use nervous system medications to treat a lot of different conditions. We use nervous system or medications that affect the nervous system for pain, anxiety, depression, insomnia, convulsions. Also, we use them for conditions not necessarily considered nervous system disorders, such as irregular heart rate, blood pressure, asthma. Because of the action of these medications affect the nervous system as they innervate these different systems, such as the heart, the myocardial muscle, the nerves of that innervate the capillaries and the arteries to cause dilation or constriction, medications that prevent bronchoconstriction or encourage bronchodilation. So this unit, in a way, is very important because it's going to lay the foundation for a lot of the different medications we're going to talk about, not only in this unit, but in other units as well, and especially when we get to the cardiovascular unit. Now, just briefly, I want to touch on the divisions of the nervous system. I'm not going to go a lot into the anatomy and physiology of the entire nervous system, but there is a section of the nervous system that we really want to understand, and that's the autonomic nervous system, so we'll get to that. The central nervous system, you know, is the brain and the spinal cord, and the brain is the processor, sends out signals, it receives signals via the spinal cord, and so the transport system essentially is the spinal cord. Then we have the peripheral nervous system, and this is nervous tissue outside of the central nervous system, and it's primarily divided into two divisions, the somatic and the autonomic nervous system. The somatic nervous system is voluntary control over skeletal muscles, so this allows us to talk, it allows us to walk, it allows us to take a deep breath when we want to, or to hold our breath when we want to. However, normal everyday breathing that we don't think about on a continuous basis is based on the autonomic nervous system. And so the autonomic nervous system then is involuntary control over smooth muscles, the cardiac muscles, and certain glands. The autonomic nervous system can be overridden by the somatic system, as I discussed by talking about the fact that we can choose to hold our breath. However, at certain points, our voluntary control is limited, and the autonomic nervous system will kick in. So the autonomic nervous system innervates organs such as the heart, the digestive tract, the respiratory system, reproductive system, arteries, salivation, and portions of the eye. And you'll see this as we talk about each one of those as we break down the autonomic system even further. So the primary functions of the nervous system are to recognize changes in the internal and external environment, process these changes, and to produce an action or a response to those changes. So again, the autonomic nervous system is involuntary control over smooth muscle, cardiac muscle, and glands. There are two subsystems to the autonomic nervous system. That's the sympathetic nervous system and the parasympathetic nervous system. So let me back up just a minute. And if you think of the autonomic nervous system as controlling essential or vegetative body functions at an unconscious level, this tells you that even when a patient is in a comatose state and they seem to have no consciousness. This is when the autonomic nervous system is completely in control and controlling those body functions. So almost all of the organs and glands receive nerves from both branches or both subsystems of the autonomic nervous system. So the SNS or sympathetic nervous system and the PSNS or parasympathetic nervous system work as a team, and when one is in control, then the other is on standby. So they work in tandem, but typically they're not both evident at the same time. When we talk about these, we want to break them down a little bit further into their neurotransmitters, and we'll talk about neurotransmitters pretty quick here. But when we think about the sympathetic nervous system, we think about adrenergics, and this is especially prevalent when we talk about medications that mimic or affect the sympathetic nervous system. Those are adrenergic drugs. And then cholinergic drugs are drugs that mimic or act the same as the parasympathetic nervous system. So you have a handout that looks kind of like this picture here, only it actually has, it's bigger and it has both the parasympathetic and the sympathetic nervous system. I like this picture because it breaks down some of those organs. So again, the parasympathetic nervous system are the cholinergics when we talk about drugs. Parasympathetic is activated under non-stressful conditions, and you might remember having heard this called the rest and digest system. So this is when we are calm and relaxed, is when we are going to see the parasympathetic nervous system in control of our autonomic nervous system. So the parasympathetic nervous system controls our thoughts, our feelings. It controls visceral activities such as our digestive system, and it helps to relax our muscle actions. It controls our day-to-day activity of eating, digesting, and eliminating. So take just a quick look at this picture, and you have this handout in your packet, and it's on Insight NC. So if you don't have it with you, now's a good time to get it. And if you haven't printed it off, or if it's not in your packet, then you should print that off. And above that, where it says parasympathetic nervous system, I don't think I said that right, did I? Parasympathetic, I don't know what I said. Write cholinergics, and this gives you a clue to the neurotransmitter acetylcholine. And acetylcholine is the neurotransmitter for the parasympathetic nervous system. Parasympathetic nervous system drugs that mimic or act like the parasympathetic nervous system are the parasympathomimetics. Long word. Simply means that they mimic the PSNS. Another set of drugs would be adrenergic blockers, meaning they block the adrenergic drugs or system, which is the sympathetic nervous system. So if we block the sympathetic nervous system, what does that leave in control? And that's going to leave in control the parasympathetic nervous system. By knowing that, you might ask yourself, why do I care? Well, I hope you're asking yourself, why do I care? Because by understanding that cholinergics are going to have the same effect as stimulating the parasympathetic nervous system, I can anticipate the therapeutic response. So if I give a cholinergic drug, I can anticipate that it will constrict pupils, that it will stimulate salivation, that it may cause bradycardia, that it may cause bronchoconstriction, that it can increase digestion, so increase emptying of the stomach, increase peristalsis of the intestines, stimulate the gallbladder to release bile, which is going to aid in digestion as well. It can contract the bladder, which is going to help me to empty my bladder, and stimulate sex organs. You can probably figure out what that will do for you. So again, if I give an adrenergic blocker, then that means the sympathetic nervous system is out of the picture and the parasympathetic nervous system takes over. So think for a few minutes, when would cholinergic drugs be beneficial? And, you know, if I have a patient that's tachycardic and this is an abnormal rhythm and I need to slow that heart rate down, then maybe I need to give a cholinergic drug. I can give a cholinergic drug to someone who has dry mouth syndrome. Someone who has constipation might benefit from a cholinergic. And it also lets me know what side effects might occur. Maybe I'm giving it for bradycardia, but a side effect might be diarrhea. So hopefully you're starting to see where knowing what the parasympathetic nervous system does and the fact that these are cholinergic drugs that we would be using to stimulate the parasympathetic nervous system, what kind of effects are those going to have on my patient. So the other half of that handout then is the sympathetic nervous system. And the sympathetic nervous system you might recognize as, or have heard before, as fight or flight system. And it's activated under stressful conditions. So again, we want to know, what is the neurotransmitter? The neurotransmitter for sympathetic nervous system is norepinephrine. And you might have know that epinephrine as a stimulant stimulates heart rate. So norepinephrine is similar in that it's a neurotransmitter. So these are considered adrenergic drugs or sympathomimetics. So these are stimulating the sympathetic nervous system to do what it does. So let's look at some of the things that the sympathetic nervous system does. It's going to dilate pupils. Think about what would happen if I give a patient with glaucoma a sympathomimetic or an adrenergic drug. Is that going to help glaucoma, or is it going to make it worse? So you're starting to see that these considerations and understanding the background, the physiology, helps me to determine the actions of these medications. It inhibits salivation, so a side effect of adrenergics is going to be dry mouth. It increases the heart rate. Well, when are there times when I would want to increase the heart rate? If I need to increase cardiac output for some reason, then I may need to increase the heart rate. And certainly if someone is chasing me and I need to run, then I need increased cardiac output because I need to pump blood to my leg muscles so that they can get moving. Dilates or facilitates breathing, so it dilates the bronchi. This would be useful in asthma or COPD, so adrenergic drugs are certainly going to be beneficial to those disease processes. The physiologic reason for it, again, is that if I need to perform a strenuous activity, all of a sudden, I need to move some air. So bronchodilation or ease of intake of air is certainly going to benefit me as I attempt to run away or do whatever it is that needs to be done. The sympathetic nervous system inhibits digestion. Now remember, the parasympathetic aids digestion. Now why would we want to inhibit digestion? Well, I need to divert that blood supply somewhere else in order to run away And so it doesn't make any sense that I would be attempting to digest my meal when I'm worried about becoming someone's meal, perhaps. Stimulates release of glucose. My muscles are going to need that glucose for energy. I can't live on oxygen alone. So it provides me with that. Stimulates the adrenals to secrete epinephrine and norepinephrine. Relaxes the bladder so that when people are scared, what happens? Sometimes we have an embarrassing accident, and that's because the bladder has relaxed and the sphincters relax, and it allows emptying of the bladder. And then, of course, again, if I'm running for my life, the last thing I need to be worried about is the attractiveness of the person running next to me. So if you have this handout, above sympathetic, I would like for you to write norepinephrine. And norepinephrine is the neurotransmitter for the adrenergic nervous system, or sympathetic nervous system. Drugs in this class are called, or that stimulate the sympathetic nervous system, are adrenergics, or they can be called sympathomimetics, or cholinergic blockers. So again, if I'm using a cholinergic blocker, that means it's going to block the parasympathetic nervous system, had a little brain fart, and allow the sympathetic nervous system to be in control. Now, I've mentioned neurotransmitters a couple of times, and so I think at this point, hopefully you're going, well, what is a neurotransmitter? And again, why do I care? Well, neurotransmitters are the chemicals that allow impulses to cross this synaptic cleft. So you can see that we have a presynaptic neuron, and that means that this is the nerve cell that the impulse starts with, or is coming down. Imagine that all of these nerves are like I-35, and on one side of the road everything is going one direction, and on the other side of the road, so all of our nerves are going to be in pairs, and one is heading one direction, one is heading the other direction. So this presynaptic, this would be before the toll booth. And at the toll booth, what do we have to do? We have to hand over some money. And that's our neurotransmitter. It allows us to pass and continue on down the road to the postsynaptic neuron. So the neurotransmitters are generated or produced in this presynaptic neuron. That's where we're coming from. And then they travel across, or they enter into the synaptic cleft, and if it's the right neurotransmitter and nothing's interfering, then it's going to find its receptor on the postsynaptic neuron. And it's going to fit in there, and that signals the nerve impulse to continue down the line. So the impulse is regenerated and goes on. So the neuron is the functioning cell of the nervous system, transmits the information, and then that cleft is that space. So again, why do we care about this? We care because many drugs have the same or similar structure as these neurotransmitters, and they're going to work at the level of the autonomic nervous system. So generally speaking, we can regulate neurotransmitters by pharmacologic agents. We can control things such as blood pressure, we can control dysrhythmias, we can control vasoconstriction, We can control smooth muscle activities, such as relaxing smooth muscles, simply by altering these neurotransmitters. So we can encourage neurotransmitter production. We can keep neurotransmitters from being broken down. We can encourage or increase the receptivity of the neurotransmitter. So we have lots of different neurotransmitters in our body, and we use pharmacologic agents to impact those neurotransmitters in a way to get the response that we want. So the two primary neurotransmitters that we're interested in are norepinephrine and acetylcholine. Norepinephrine is released by and works on the sympathetic nervous system. These are also, again, called adrenergic nerves. It's important for you to get that information stuck in your head, because when we talk about these medications, we're going to call them adrenergics, or we're going to call them adrenergic blockers if they are stimulating the PSNS. So if we're stimulating the sympathetic nervous system, what effects do you anticipate? Well, it goes back to all the things that the sympathetic nervous system does. So we're going to anticipate having an increased heart rate. We're going to anticipate dry mouth, pupil dilation, decreased peristalsis, increased ease of breathing or bronchodilation. So these are the things that we need to know. A patient on adrenergics may experience constipation. Well, is that considered a side effect that we should expect? Absolutely. And we need to know those things. So acetylcholine then is the neurotransmitter for the parasympathetic nervous system. It has the opposite effect of norepinephrine, and it's going to stimulate or act on the parasympathetic nervous system. The PSNS is also called the cholinergic system. And you can kind of remember that because we have acetylcholine and cholinergic. And so if you put that together, then you don't have to try to memorize norepinephrine sympathetic, because we know that if acetylcholine is cholinergic, that only leaves norepinephrine for sympathetic. The parasympathetic system only uses acetylcholine. Now, the sympathetic nervous system uses primarily norepinephrine, but can use acetylcholine as well. And that's just a kind of a fun fact. Nothing that you need to spend a lot of time deciphering. So this is just a visual for the SNS and the PSNS. So you can see that the end result with the sympathetic nervous system is the release of this norepinephrine at the target tissue, and this is where the action is going to occur. So if we get to here, the target tissue, and it's the eye, what does the norepinephrine do at this point? So you can see where the acetylcholine comes in farther up the line with the sympathetic nervous system. What we're interested in is this target tissue, and that's where the norepinephrine is going to play its role. So on the eye, we're going to see that pupillary dilation. If it's the heart, for now, we're going to consider that it increases heart rate or if it's vessels, that it's going to cause vasodilation or vessel relaxation. So what is going to happen when that norepinephrine gets there? With the parasympathetic nervous system, then we're going to see that acetylcholine is the transmitter all the way across. Again, we're interested in what's happening at the target tissue. So if we have acetylcholine stimulating the target tissue of, say, the lungs, what are we going to get? We're going to get bronchoconstriction. The bladder, we're going to get constriction or contraction of the bladder muscle. So these are things that we need to be considering. So this just gives you a picture so you can, if you're a visual kind of person.